Good morning, everybody. Yesterday was another record day of testing. 117,000 people came forward to get tested, which we're deeply grateful for. It shows the community is responding to our calls to maintain those high rates of testing. We had 207 cases of community transmission in the last 24 hours to 8 p.m. and at least 50 of those were infectious in the community during that time. And obviously that is a number we want to see reduced over the coming weeks. The main form of transmission remains workplaces and also households, and that is being consistent. And of course, that is what we're trying to break the back of moving forward. Can I stress that August is the month where all of us should come forward and get vaccinated? It will be a combination of seeing where the case numbers are in a month's time, as well as the rate of vaccination that determines what August 29 looks like. I've been saying for some months that 80% of the adult population vaccinated would get us freedoms beyond no more lockdowns, and that's 10 million jabs. But clearly when we get to 5 million jabs, or when we get to 9.2 million jabs, which is the 70% number, we'll be able to have a bit more freedom, obviously, than what we do today moving forward. I can't stress that enough. It's really in our hands as to how we deal with the cases coming down as a community, but also our rate of vaccination. And I can't stress that enough. One learning we've had in the last 5 weeks is that the vaccinations, both vaccines, are working extremely effectively. We still don't know of anybody in intensive care who's received both doses of the vaccine. Now that is a positive thing. We know the vaccine's working and we need people to come forward and get vaccinated. In particular, our efforts will be focused this week and next week on businesses, on workers who are working in those local government areas and having to go out of those 8 local government areas in particular, but also people aged between 20 and 40. Unlike the flu with COVID, it's people in their 20s, 30s and 40s that are most mobile, that are between 2 generations or within 3 generations, that are causing both getting the virus and spreading the virus. So it's really important for us to get people aged between that 20 to 40 age group vaccinated as well. We're urging everybody to come forward, whether it's through your GP, through a local pharmacist, and of course through our New South Wales health hubs. And a number of new hubs are being established every day, including in community halls, in places of worship, places where people feel comfortable. And of course, as I announced a few days ago, next Monday means Kudos Bank Arena is open for Year 12 students in those 8 local government areas, and after that it will be converted to yet another mass vaccination hub. So I say to everybody, let's make August the month we all come forward and get vaccinated. We've always had a sense of urgency in New South Wales, and today is a greater sense of urgency than ever. We have the potential to really speed up the program. We're doing about 500,000 a week through all of those sources, those points of access, and we urge everybody to come forward. Thank you. Dr. Chan.
Thank you, Premier. So there were 207 cases of locally acquired COVID-19 and 2 were overseas acquired. A record of 117,009 tests. Now, can I just thank the community and also the pathology companies for processing those tests, as also the swabbers. As the Premier had indicated, we're still seeing a large number of people infectious in the community, and they're leading to infections in workplaces, and they're also leading to infection in other settings. It is critical that every time we move about, we assume that someone near us is infectious with COVID. So that physical distancing, keeping that 1.5 metres away, making sure you're wearing your masks at all times properly, will provide a level of protection, but also make sure that your trips are as short as possible. It is important at this time that we keep all interactions down minimally. As I've indicated before, if you've got shops, make sure that you don't enter the shop if it's crowded. In terms of the other highlights today that I need to emphasise is there is an aged care outbreak in the Wyoming nursing home in Summerhill, and sadly there's 18 patients and 2 staff that have been impacted in that facility. The positive patients have been removed from that facility, and a number of, as a precaution, the remainder of residents of that facility are also being removed from hospital. So the outbreak is occurring on that top floor, and that action has been taken as a precautionary approach. I can confirm that 83% of the patients were vaccinated and 75% of staff at the facility were vaccinated. It is, again, a salient lesson. I urge anyone in aged care to take up vaccination. You will have other additional opportunities. As I understand, the Commonwealth is going back into those facilities and is also working with general practitioners to offer vaccines to those who may have missed out. So please accept the vaccine. It is critical. That is your household, and I think you would think of your other residents and others in that household as part of that household group. So please take up the vaccination to protect you, but also your the other residents in those facilities as well as the staff. Sadly, we've also had a death that has been notified. A man in his 90s from southwestern Sydney died at Liverpool Hospital. He had received 1 dose of the AstraZeneca vaccine in April, and he was linked to the outbreak in the aged care facility at Liverpool, the aged care ward at Liverpool Hospital. So my condolences to his family and his friends. Again, this highlights another point, that 2 doses of the vaccine are more effective, so even 1 can provide protection. So there is an opportunity to bring forward your second doses of AstraZeneca to afford that protection. So please, anyone who's had an AstraZeneca shot with a spacing of 4 weeks, come forward and get vaccinated. In terms of the other call out, to echo the Premier's words, I really am encouraging workers in the affected local government areas to get vaccinated. What we're seeing, sadly, is a number of transmissions in workplaces, some as many of 30 colleagues in some workplaces that have been infected. It is critical that people don't work whilst they've got symptoms, but also you can take the proactive step of choosing to get vaccinated. That will again protect your loved ones and also your colleagues at work. Thank you.
Premier, why are Pfizer doses for the high school kids coming from the Central Coast when the Central Coast is in lockdown? Is it just a coincidence that many of the seats on the Central Coast happen to be Labor seats?
First of all, that question offends me. We're doing what is in the best interest of public health. And can I stress how important it is for us to get Year 12 students able to complete their HSC exams and make sure that they have those qualifications they've worked hard for. So we know that for 16 to 18-year-olds, Pfizer is the only option, and we wanted to make sure not only that we're giving them that opportunity to get their HSC, and I think people understand that, but there are 8 million citizens in New South Wales. All of us are making a sacrifice, and if it means that some people have to wait a few extra weeks before they get their Pfizer, I think people would appreciate.
But it's in the lockdown zone.
I think people, that their decisions that our health department takes, how the vaccines are allocated is not a decision that someone like myself would take.
Does that puzzle you that health have decided to take
it? Does not puzzle me, because what is really important is for our health officials to do what they are expert at, and that is to make sure we prioritise the vaccination rollout. But can I urge everybody, and Dr Chant has said this repeatedly, the health advice for Greater Sydney has changed in relation to AstraZeneca. All adults can come forward and get the AstraZeneca vaccine. If anyone has concerns, they can go to their GP. And can I say, first and foremost, our priority is to get out of this lockdown as soon as we can and to reduce the stress for anybody as much as we can. And for communities where they've seen low to zero rates of cases, there's a chance that obviously they can come out of lockdown sooner than others, and that is an opportunity all of us look forward to. So whether it's the Central Coast or Shell Harbour or Wollongong, there's opportunities for us to consider that status based on the health advice. But please know, all those decisions about prioritisation of vaccines or how vaccines are distributed remain health expert advice led. We know where the cases are circulating, we know where the virus is circulating, and reducing the cases, can I make this point? and I know that most people share this sentiment. We are all in this together, and if we reduce the cases and we reduce the virus circulating in particular communities, it means all of us can have a greater sense of opportunity for freedom moving forward, because reducing case numbers, reducing the number of people infectious in the community helps all of us.
Just on the 5 million,
I'll let someone else have a question. Yeah.
You mentioned the 80% target, the 70 and the 50 you mentioned. On current basis, we're not going to reach that until September, October. Will we be able to see the lockdown at least come off without us reaching those targets, or is it all hinging on that?
Well, that's why I've said that once you get to 50% vaccination rates or 60% vaccination rates, you can look to provide easing of restrictions, but that also depends on where the case numbers are at. So it's a combination of things. We need to look at where the case numbers are at. We also need to look at the vaccination rates. And pleasingly, New South Wales has about 3.9 million jabs we've administered, so we're getting close to that 4 million number. And we know that once we get to 9.2 million, that's 70%. Obviously, 5 million is about half of our target, about 50%. So it's really important for us to increase that vaccination rate. We're doing about 500,000 a week. And anything above that is a bonus. It means if more people come forward, if more people get vaccinated, we get out of our existing situation sooner than we otherwise would. And that's the real strong message I want to send across to everybody. It's a combination of reducing, obviously, the case numbers we have, but also increasing the vaccination rates. And it doesn't necessarily mean we'll be as free as we would like at 80% or 70%, but it does mean we can live life more freely, and that's something we should all aim towards. And I want to send a strong message to the community. We've been going on this journey together, but if we work hard, reduce those case numbers, appreciate why the health experts give us advice to do things a certain way, that means also, in combination with higher vaccine rates, that we can see life more clearly beyond August 29.
Focusing so much on the vaccine targets and the vaccine rates, this is an admission that perhaps we're not going to get to zero or close to zero in the next 4 weeks.
No, I think I've been talking about the 10 million target and vaccine rates for months and months. If you look at my comments personally, for months and months we've had a sense of urgency because we've seen what's happened with the Delta strain overseas. We've seen that you can't live with Delta unless you have a healthy rate of vaccination in the community. I've been speaking about this for months and months. And I remember being criticised at the time when we put out the 10 million figure, we said we based it on the health advice, and that's proven to be the case. But obviously, once you hit other milestones like 50% vaccination or 60 or 80, does bring with it certain conditions. But that also depends on where the case numbers are at that time.
Or if we get to 50 or 60%, if they're not close to zero, we could still see restrictions eased.
Well, look, obviously, the closer we get to the infectious people in the community to zero, the better. It means we can have more freedoms. But that figure, combined with the vaccination rate, will determine the health advice. If the health experts give us advice to say vaccination rates are at a particular level, case numbers are at a particular level, which means we can have some level of freedom back, that's a positive, and that's what we have to aim towards. But it's the combination of reducing case numbers as well as increasing the vaccination rates. But I think what is eminently obvious is that, and look at all the states around Australia, that you can't live with Delta without going in and out of lockdown, or at least until you have the vaccination rate high enough. And that's what.
And I'm getting close to zero.
Look, we never lose the opportunity to get close to zero in terms of our infectious rate. That is always our target. But what we're saying is if you have a healthy vaccination rate, it does give you better options to how we can live more freely, and that is what we're looking at. It's a combination of the two. Our strategy is obviously to reduce the number of people infectious in the community, but also to increase that vaccination rate, because that will determine the level of freedom we have moving forward.
While we're talking about the infectious in the community numbers, you give us preliminary numbers, but we never find out the final numbers. There's always a large number being under investigation. Will you undertake to publish either a 7-day rolling average?
Oh, we do. We already do. We publish a weekly report, but please appreciate sometimes you might get a test result at 7:30 the night before, and all your contact tracers work hard overnight, and they might have the answers during the course of the next day. So that there's a weekly report which health publishes with all that information.
But what I'm saying is,
what's the true level?
Sorry?
The EPI report hasn't been updated since the 17th of July. We had 120 cases on Saturday that were unknown isolation status, 98 cases yesterday. How many of those were in the community whilst infectious?
So we are prioritising getting that EP report out. As you can imagine, our priority at the moment has been focusing on other aspects. So we will work hard to get that epidemiological report. I think that's a very good document and a single source of truth. Obviously, when the cases come in and there's large numbers of cases, it does take a while. And our priority really is contacting people, making sure they're aware they're a case, getting their contacts in for testing, because that is the critical public health action we need to take. We then assess their risk factors and do the other data item collections.
So how many of the weekend cases that were unknown isolation status? How
I
many?
think we'll have to. I haven't got that data with me, but as I said, we've always been very transparent in our epidemiological report that we publish weekly. It's a good read. I'd encourage anyone to do so, and we're working hard to get it out.
Dr. Chan, can you just clarify what are the workplaces where we are seeing this transmission happening that you've mentioned, you know, up to 30 cases in some cases, and how are you working with those industries perhaps to help them tackle that transmission?
So we've recognised a number of industries, and they probably reflect the ones that are necessary to keep us as a city going. So, for instance, freight is an example. We've also had that's generated a large number of cases in some of the freight businesses. We've had smaller outbreaks in tinier workplace settings. We've also had our incursions or positive cases in food processing, distribution units. Again, they sometimes, because of the good processes that people have put in place, have not led to large numbers of cases, but they're obviously complex because we need to keep those workplaces operational, and we need to do quite a lot of work in terms of finding out the close contacts on those big workplaces. So to some extent, this is a partnership with the industry. I really appreciate the work that a number of the big food and grocery chains have put in place, a number of the food processing, abattoirs, those sort of premises where they are working, and there's also close contact between workplaces. Again, just a call out in the messages, it's really important that you think about the tea rooms and some of those social settings in workplaces, because it sort of avoids the problem if you might have the best safety plans for the actual premise, but if people go and congregate somewhere, it defeats the purpose of the segregation. So I just want to also acknowledge the hard work that the industry's done, and they've picked up a lot of learnings.
Sorry, the Queensland Chief Medical Officer has again said today that she doesn't want 18-year-olds having AstraZeneca. Is that your view too?
My view is that we follow the ATAGI advice, and ATAGI's looked at risk-benefit. So clearly the advice is for people to have the discussion about the risks and benefits. Everyone's got their personal considerations. They live in different parts of the city, their risk is different. And so for me, it's around informed consent. I would also be very concerned if people did not know what actions to take. So if anyone develops headache or abdominal pain following AstraZeneca, it is important that you seek urgent care. But as I said, I'm very much committed to following the expert advice of ATAGI.
Sorry, just with vaccines, under 16s are currently not in line to be vaccinated. Is it realistic, or how realistic is it that children go back to school this year?
Look, it really depends on the numbers. You know, we are hoping to see a turnaround in the numbers. Every bit of vaccine helps us. So the way that it works is that if we have a positive case and everyone in that facility is vaccinated, one, it doesn't actually cause severe illness and you don't lead to those ongoing chains of transmission. So vaccines work in two ways, and that's why we're placing so much emphasis on vaccines. Also, what we're saying is that younger people are the driver of this through their attendance at workplaces, and they also bridge age groups. So we are also looking at focused vaccination in those high-risk industries, again in partnership. So our teams in our local health districts have gone out and vaccinated, at various processing plants, and that's part of the strategy to actually target those highly mobile younger workers.
To have schools not go back for the rest of the year is very serious.
Sorry, Dr. Chan, we're talking about under 16s and getting
getting kids back to school? Because obviously they're not in line to be vaccinated. So how realistic is it that children are going back to school this year?
I think the key issue is how we go, how we work together as a community and industry and us in terms of making services available so that we can get the numbers down. We are in no way committed to not achieving a marked reduction and moving to zero community transmission. It is hard. This is complex. It is hard. But we need to work together, keep our eye focused on the outcome. And the point is that by increasing vaccination, it will assist us. But everyone has a part to play. And so I don't want to even think about whether what the situation will be at the end of August. It's too premature. We've got 4 weeks. We need to give it our all. And can I just say a big call out to all of the staff in the public health units and all of the staff that are working so hard to drive these numbers down. We can do it, but it's going to take us working all together.
Dr. Chan, to have schools out for the year, obviously you appreciate, and the Premier appreciates, very, very serious. Well, are you ruling that out?
So,
but just on that, doesn't it then make sense to go harder with this lockdown, including curfews, as Victoria did? And Premier, can you rule out school being out for the rest of the year?
So I think
in terms of 5 day a week?
I'll let the Premier answer that, but can I just say, we are taking a day at a time. We are focused on the end game of end of August. We need to drive the numbers down. These are too high, and we are working across government to support affected communities, to make testing readily available, to put support in place so that communities can adhere to the orders. We also are looking at compliance, but the vast majority of the community is doing the right thing. What we're putting in place is systems to enable them to do that. And we're adding vaccine to the mix, and that works, as I've said, in 2 different ways. It protects the individual, so the consequences for them are less, but it also reduces their likelihood of onward transmission.
The Premier needs to answer, sorry. Are you ruling out?
Oh, sorry, I'm answering this question first, yeah.
You've been speaking about getting communities down to low or zero transmission, that you would consider letting them out of lockdown. Shellharbour has been at zero throughout the entire lockdown. Why is Shellharbour still in lockdown?
No, it's important for us to say, and that's a very valid question, if the health experts tell us that the Central Coast, Shellharbour and Wollongong are able to be treated as regional New South Wales, we will take that advice. Now, it's very positive that we've seen very close to zero or very low numbers in those regions, and if the health experts say to the New South Wales Government those communities can be treated the same as the rest of regional New South Wales, we will take that advice. I want to make that very clear, even if it's ahead of the 28th of August. If Dr. Chant and the experts say there's sufficiently no numbers or no numbers in those areas, we will, and I think that's an incentive for those communities to keep doing what they're doing. We have had a few scares, we have had a few cases in those regional areas, but if we can demonstrate, if those communities can demonstrate that they're close to zero or don't have the virus circulating, well, the health experts will take that advice on board.
Premier, are you looking at the numbers, given that the number of people in the community hasn't changed really, are you looking at the numbers and thinking this lockdown is a success so far?
Oh, look, I think whenever you have, it is not a success when you have your community living in lockdown. That is what future success will be, is having our population live as safely and as freely. I don't think anybody's going to suggest, least of all me, that living in lockdown is a good place to be. It's horrible. But we know we have no option at this stage. The Delta strain is proving around the world to be a lethal strain, and as even other states in Australia are finding, it is really, really difficult to control. So what the strongest message that Dr. Chant, myself and Minister Hazzard and the whole team can send to the community is August is the month where all of us should come forward and get vaccinated, because getting the vaccine not only protects us and our family, but it also reduces how contagious people are. We have to focus on workers and people between the ages of 20 and 40 who are particularly mobile, including in those 8 local government areas. And we can also sense that what what the world looks like on the 29th of August will be determined by what happens in the next 4 weeks. And part of that, a large part of that, is up to all of us. Getting higher rates of vaccination, sticking to the health rules, really allows us to have a fighting chance to have a better level of freedom, obviously, than what we have now, and that's our aim. But least of all, can I say this? I don't want anybody jumping to conclusions about what will happen or won't happen by the end of the year. Let's just take 1 month at a time. Let's just see how we go in August, and please know that every decision we take is based on the health advice. I don't want people feeling concerned beyond August as to what life might look like until we get closer to that time. But please know that what will assist us greatly is if people come forward and get vaccinated, especially those who are working in critical work, in authorised work, especially those in health settings, those that are more vulnerable. It's really important for as many of us as possible to come forward and get vaccinated. We're at 3.9 million jabs already. Obviously, 5 million jabs means we're halfway to our 80% target, give or take, and 9.2 million jabs gets us to 70%. But that's all critical and important, but that also has to be put into context with what the case numbers are doing at the time. So the best outcome for us by the end of August would see a reduction in case numbers and a higher rate of vaccination. That is the best outcome we can hope to achieve, and I'm really keen for us to have those goals in sight. The goal is for us to live as safely and as freely as possible, and the higher the vaccination rate, the greater options we have to getting there.
Premier, the goal is for 80% of adults to be vaccinated. There is no plan about children. How do we come out of lockdown? How do we open up and live freely if under 16s are not vaccinated?
Well, that's based on the health advice. So the health advice tells us that unlike the flu, where children mainly get it and spread it amongst themselves and others, with COVID, the health expert advice is telling us that people aged between 20 and 40 are those greatest at risk of getting the virus and spreading the virus. So we're basing all of this on Dr. Chan's advice, but also the advice coming out of the experts through National Cabinet. So the targets that they have set for us are coincidentally the targets that Dr. Chan had provided me months ago, which is once you have 80% of your adult population vaccinated, you can look forward to living life freely and keeping case numbers at a manageable level. And that's the best health advice we have from Dr. Chan, but also now confirmed through National Cabinet processes. But until that time, we will live with some level of restriction, and the level of restriction is dependent on two things. The level of restrictions will also be dependent on how close to zero we get with those infectious in the community, plus the vaccination rate. And they are the things that will drive decision making moving forward. And we've always said lockdown and restrictions are important to manage COVID, but you can't live with COVID, the Delta strain, you can't live with the Delta strain or what's around the corner unless you have those high rates of vaccination.
Can you rule out that parents will be required to homeschool their kids? Can you rule out school not going back until 2022? Can you rule that out?
Look, I can't predict the future, but I certainly am confident that schools will go back before then.
Premier, New South Wales is going to seek approval from the state government to have a vaccine passport for anybody who wants to go to NRL, AFL, etc. One, what's your position on that? And two, should bars introduce something like that?
I think our priority is getting people back to school and back to work. Can I make that very clear? So I think there's merit in us considering how quickly we can get people back to school and back to work, and they are the priorities of the government. All those other things, of course, will come in good time. But it's important that if large groups of people in certain industries are coming forward and getting vaccinated, that will give us greater confidence in how we ease restrictions moving forward.
The issue is, though, whether venues in New South Wales should be allowed to block entry to people who haven't been vaccinated. Surely only allowing entry to a football match if people are vaccinated is one of the incentives that you spoke about, giving vaccinated people right back when we started the rollout.
Can I say people are worried now about getting to work and getting kids back to school. They are the priorities. So any incentives we can provide to encourage people to get vaccinated, to encourage people to keep the health restrictions, that is our priority. All those other things are great and will come in good time. But we have to appreciate that certainly everybody's priority is getting kids back at school and getting workers back in their workplace, and they are our priorities. All those other things can happen in good time.
So will happen next year?
Well, I'm not going to put a time on it. Dr. Chan, I wish.
Do you support
I wish we had a crystal ball on those matters, but I will say this: we can look at those opportunities in a little while. But let me stress, we can look at all those opportunities in a little while, and I think incentives are a good way to move forward. But let me be clear: today I want to talk about kids getting back to school and workers getting back to work. They are our priorities, and all those other things will come. All those other things. Please let me finish my sentence. All those other things will come in good time.
You're talking about August being a drive to push for vaccine. This is the month to get people vaccinated. Isn't this the time to put this stuff on the table? These are the perks, these are the benefits you will get in a life after being vaccinated.
Look, absolutely, potentially. But we also appreciate that we need to get jabs in arms as quickly as possible before we can have those conversations. We know from the health advice that's been provided through our own experts in New South Wales and also those through the national process, that you need a certain rate of vaccination before you can look at those things. And that's why I'm saying let's make August the month where we really increase our vaccination rate, because it gives us greater options. And I think it's really important for us as a government, and we've already been having those conversations about incentives and how we can incentivise people to get vaccinated, how we can incentivise them to take care of themselves, their family and the broader community. And that's definitely on the table. I want to stress that. But I also want to stress that I bet you if you did a straw poll of people, households across Greater Sydney, the Central Coast, Wollongong, Shell Harbour and regional New South Wales, people want to make sure our priorities are getting children back at school and also having people work in their workplaces, and they are our priorities. And all the other stuff is very, very important. We appreciate how tough it's been for many industries that have been out of action, and those incentive schemes are definitely on the agenda. We've been talking about them for some time, so I don't want to rule any of them out. In fact, we are as a government amenable to those things, because we appreciate that when people have a goal, when people have something to look forward to, they're more likely to do something, and that's just human nature. So I do want to stress that those things are on the table, but I don't want that to take away from the fact that we understand what stress people are going through at the moment. They want homeschooling to end and they want to be able to work.
The Summer Hill situation, sorry. All the residents now are coming out. Is that what you said before? They're all being taken out?
My understanding is that there's 2 floors on the facility, the top floor and bottom floor. All of the residents in the top floor are being removed. Some of them are COVID positive and some of them are COVID negative. So as a precaution to support the staffing and to reduce any infection control risks in that facilities, that action has been taken. My understanding that residents on the lower floor have not been exposed, but as this has been precautionary action to protect the residents. And can I
roughly residents you're talking about?
Sorry?
Do you know roughly how many residents that is you're talking about in that top floor?
30 residents.
And when was the first case detected in that facility?
I would have to check when the first case, but certainly that's been.
Not vaccinated, Dr. Chan.
Sorry?
A couple of the cases, like 3 of the cases at that Summer Hill home, were not vaccinated because they chose not to be. Can you provide any information on how they're doing?
So I'm aware that one person is in getting care in hospital in a more higher acuity, a more what's called a higher dependency unit, and that person isn't vaccinated at this stage. Clearly, my key message to everyone is that the vaccines work. 2 doses are better than 1. But even 1 dose, getting that now is appropriate. We are going back and obviously offering vaccination to those residents that may have not had the opportunity or declined vaccination. It really is important, and I suppose my call out to residents of those private aged care facilities, that you think about yourself but also the other residents and staff in those facilities in making your choice about whether or not to get vaccinated.
We're hearing about another one as well, Breedsby and Blacktown. There's aged care homes there.
There's a number of there are a large number of aged care facilities that have been impacted, and that relates to particular AIM who worked across some facilities. Yes, we've taken that issue up with the Commonwealth just to clarify the nature of that. Obviously there's been guidance out, and I understand the Commonwealth has support payments in place to support health workers not work across multiple aged care facilities.
Sorry, I'm going to clarify that, if I may. So one nurse worked across multiple facilities. Which ones?
I understand. I will have to get the details. I don't want to give you incorrect information, but we are just working with the Commonwealth to ensure that that procedure, which is again a protection, where staff do not move across multiple facilities, is firmly in place.
Dr. Chan, specifically in relation to vaccination thresholds, right? We've been talking for weeks about getting the number of infectious cases in the community down to zero until yesterday, when the Premier is now talking about getting vaccination rates up, getting to 50, 60, 70%, which will all provide us freedoms, even if the case numbers do not get down to zero. In your view, what freedoms would we get at 50% vaccination coverage if the number of cases in the community, whilst infectious, do not get down to zero?
I think it's really important that we've got both a global strategy to increase vaccination, and that's our long-term approach to getting out to living with COVID. But the second component of the strategy is very much a targeted vaccination strategy. So what we want to do is target the workers and those high-risk premises in the affected areas. So there is a global target, but also we are redirecting and refocusing a lot of our effort on meat processing plants, distribution centres, freight companies. Anywhere that needs to be operational to support us provides a risk of having a workplace outbreak. So we want to preemptively get into those workplaces, those high-risk workplaces, and vaccinate them. And also the call out for young people. This outbreak in southwestern Sydney has been largely a very young demographic, which reflects the fact that the majority of people are staying at home, but those that have to work in those essential industries are going out, and they tend to be younger, and that's what's driving those transmissions both back into the household and again in those workplaces.
How confident are you that contact tracers are getting to close contacts in a timely way? We've been told it's taking perhaps a week to get to close contacts from infectious cases. Is that the case?
Certainly it hasn't been raised that there's a week delay. We are certainly contacting. Our priority is to call cases that are positive, confirm that they are cases, and then ask them for the details of their contacts. We are also asking them to text out to their contacts, and we provide sometimes a text message that they can provide, so that we can really rapidly get that testing cycle. And in some areas we have set up rapid testing clinics which have a 20-minute turnaround in the test. So the idea is that we're trying to condense the time that it takes to get to that next round of contacts. Now clearly our systems have been working under a lot of stress, but we have been ensuring that those key public health actions, and then we get back to them a bit later after those public health actions have been taken to do the full case interviews. We have got the Australian Defence Force coming on as well that commenced today to surge our staffing. So it has been a very busy time, and I just want to appreciate the fact that the positive cases have been very forthcoming with their information and really quite helpful in us identifying those contacts.
Sorry, what's the level of compliance with stay-at-home orders?
Look, that's probably more of a comment for police, but certainly...
No, I don't understand. I mean, people who are quarantining for 14 days.
Okay, so just to be clear, the stay-at-home, because there's sometimes a confusion in the public about this, when you are isolating and you're a case or you're a close contact, you're not allowed to go out of the house. You're not allowed to go shopping. You're not allowed to leave the house. So in terms of the compliance with the isolation, our colleagues in police have also been doing, so we do check compliance in a couple of ways. Often people are under clinical care. You can imagine that we have clinical care teams and people are ringing people at home to check on their health status. In addition, police have also been doing random checks, and I'd probably ask Mr Warboys to say that.
Yeah, thank you and good morning. Mr Fuller made it very clear last week that police and with the assistance of ADF would be going around doing checks on people that were subject to positive cases and also subject to orders. That has occurred over the weekend. My understanding is well over 1,000 checks have been made already. That will continue this week and in fact will be ramped up until such times as we no need to longer do it.
Dr. Chan, Dr. Chan,
Dr. Chan, the Premier says that it is the health advice that Shell Harbour is still in lockdown. What is the reason that it is still in lockdown? And I guess with regional vaccines being diverted to Sydney, is that region being used as a buffer for the South Coast because the South Coast health facilities aren't good enough to handle an outbreak?
Look, we have excellent public health units and health facilities up and down the South Coast and the North Coast. We work very closely with our colleagues across the state in an integrated way. The Shell Harbour is very we're looking at the data all the time. The advice we had at the beginning was that Shell Harbour is very connected to Wollongong, and as you're aware, we've had a number of cases in Wollongong that have, because people travel up and down from the affected, particularly the affected local government areas. So obviously we're watching the situation very closely. We understand the implications of lockdown and so don't advise the government about areas. But at the moment we want to decrease any chances of mobility. These numbers are quite high. We're watching the situation very closely and we'll obviously understand that lockdowns are challenging and would not want to impose it if we didn't feel it was necessary.
Dr. Chan, if we get Shell Harbour out of lockdown, what would it look like? Would it be vaccination rates? Would it be longer with zero transmission?
I think the issue is that we just need a little bit more time to stabilise and drive down the rates of infection in the area. I'm familiar with the geography and a lot of people do travel for essential work down from the Liverpool, Campbelltown local government areas down to Wollongong and Shell Harbour, and we just need to get those workers vaccinated. The last thing we want to see is an outbreak in those communities. We've kept them safe and that's our priority at the moment.
Dr. Chan, we got to 50%.
Pfizer to members of her family who she says were eligible but that she lost her job as a result. Is that something you'd like to see people doing? Would you encourage that rather than them going to waste these leftover doses?
Look, I'm not totally unfamiliar with that, but can I just say I do not want to see 1 ounce or 1 dose of Pfizer going to waste at this current time. We need to have as many jabs in arms at this time.
Should she get her job back? Should she get her job back?
I'm sorry, I don't know. I think I've answered it. I have no. It's a.
Yeah, but I mean, your advice to the private facility, the people who run that facility.
Look, I can't. I'm not in the position to know anything about it. I think it's premature to comment. All I would like to just stress is I do not want any wastage of Pfizer.
Dr. Chan, if we got to 50% by the end of August in terms of vaccination, but our community cases were still sitting around the that 20 to 30 mark, would your health advice say to government, you can open up bits of business, you can open up some hospitality in some capacity? Is that sort of where we're heading?
Look, I think it's all too premature. Can I just say, myself and the team are just focused on breaking the back of the community transmission. There are a lot of things that have been put in place to support community. I appreciate the work that's being done through our Multicultural New South Wales in reaching out with the community and supporting the community. We are also making testing easier and we're making sure that people are supported if they have any health needs or any other social and welfare needs. So at the moment, I want to give a message of optimism. We need to redouble our efforts and vaccination is part of it. But also businesses have a responsibility to conduct their businesses in COVID-safe ways, enforce the mask wearing, making sure they've got segregation of staff, not having crowded tea rooms. Everyone can play a part, but I'm in no way given up on achieving marked reductions in achieving no community transmission.
Dr. Chan, the Pfizer redistribution from regional areas, why have those regional areas been chosen? Which ones have been chosen? And will this delay the supply to Wollongong's new vaccination hub?
I think what's important is that the regions have been very much spared, and that has been a deliberate effort by a large number of people. At the moment, vaccinating populations in southwestern Sydney and western Sydney, and those young HSC students, they also are the workers. They're often got part-time jobs in supermarkets and other things. they are workers. And they also bridge generations. So as the Premier has indicated, that young age group through to our 40-year-olds are the sort of ones that are predominantly transmitting this. And so therefore, I look at them as students, but I also look at them as often working part-time jobs, often out and about doing other essential tasks and supporting their families. And they're often the bridge between the older generation and the younger generation. And I think that's a critical, given the way that the disease has been spread amongst that group.
Thanks, just quickly. We talked about getting everyone vaccinated, but there seems to be a bit of a delay for 18 to 39-year-olds booking an AstraZeneca shot at the Homebush hub. I looked at this morning, a first available appointment for an 18 to 39-year-old at the Olympic Park hub for AstraZeneca is in September. Is that delay because New South Wales hasn't taken up the offer of all this extra AstraZeneca that the Commonwealth has, or is there a staffing problem?
We have an abundant amount of AstraZeneca vaccine in New South Wales, and if anybody does want to have an AstraZeneca, which I would strongly suggest they do, with appropriate medical advice, if you happen to be a bit younger, then you can go to a GP, you can go to a pharmacist, or you can go to one of our hubs across New South Wales. And I just stress again that Dr Chant, the Premier, and I have all had AstraZeneca. If you have even the first jab of AstraZeneca, you have around about 90% chance, or 90% safer situation with regard to hospitalisation and death. So get your AstraZeneca. Can I answer something else just in relation to the aged care facility that someone was asking about a little earlier? Of course, that's a private aged care facility, the Wyoming Hardy, owned by Hardy, of course regulated by the federal government. I just want to make clear that there were 61 residents residing in that facility. 51 of them had been vaccinated, as I understand it, so 83%. So 10 of them had not been vaccinated for a variety of reasons. There had been a number of refusals for personal choice, others for medical reasons. I have to say that it's a very strong message, though, to everybody that you should get vaccinated, because out of those 10 who for various reasons refused to be vaccinated, 7 are positive, 7. So go and get vaccinated, it'll keep you a lot safer. Can I also answer a further question, which was how many are being transferred to hospital? There are 32 from the top floor who will now be in hospital as at the end of today. And the reason for that is that some of them are obviously positive and others are close contacts of the positive cases. The ground floor residents are at this point considered to be in a different situation. They didn't happen to be exposed to the assistant in nursing that was employed by the private hospital. And I understand that the actual numbers are believed now to have occurred off effectively a super spreading event that occurred actually in the aged care facility. Sometimes it's not a good idea to have a Christmas in July right in the middle of a pandemic, but I do understand that it's an effort to try and provide entertainment and to support to residents, and those things have to be decided by the aged care facilities. But of course, New South Wales Health and the New South Wales Government's health teams are now picking up and supporting those people who are being transferred to our hospitals. Thank you.
Thank you.